Well, we're here with Dr. Ghatan, a dermatologist in Brooklyn, and but a dermatologist who definitely does a lot of cosmetic activities, procedures which simply make us looking a little bit better, while staying away from the major, surgery known as plastic surgery and stuff like that. There's a tremendous amount of stuff which can be done, which makes a face looking a few years younger, make some wrinkles disappearing without surgery, without invasive procedures. There's equipment out there. Progress has been made tremendously in the last decade or so. Is that right, Dr. Ghatan?
Yeah, definitely. Yes, you're right on the dot.
Good. So, Dr. Ghatan,
we are very lucky now.
We are lucky because one thing I have noticed around the world, whether it's a 16-year-old girl or a 60-year-old guy, the truth is none of us likes to add 5. None of us looks to look older than we are. We don't mind so much looking our age, hopefully a few years younger. What we don't like is looking old. And very obviously the first part people look at on looking old happens to be the face and maybe the head and things like that. That is the first indicator. And if we can shave off a few years there, that would be wonderful. So Dr. Ghatan, tell us, what are some of the procedures or some of the symptoms you can fix? So maybe tell us the symptom and give us a very short a very short indication of what new equipment right now there's out for that. And just make a list, 1, 2, 3 kind of list.
Right. As you know, the sun has a huge impact on aging process that causes the wrinkling, the brown spots and the red spots, the broken capillaries, and etc. There are a lot of things you can do nowadays. There's chemical peels, dermabrasion, microdermabrasion, different kinds of laser treatments with little or no downtime that can help us. There are fillers. Fillers are materials that are injected under the skin. It's very painless, very simple.
And let me interrupt here you with filler, because I know in another video you said the word filler. I said, so you're talking Botox, and you said no, just to make sure that people don't automatically compare it with Botox. And I think that's what it is. Anyway, correct me whichever way I'm wrong.
Right. There are fillers, different kinds. There used to be collagen. Now we have restalin, we have Radius, we have a Sculptra, and we have a juviderm and Artifil and many other different products that can be used to fill in the furrows, the scars, the lines, to plump the lip, to plump the chin a little bit, to fill up the hollows of the cheek, even to make the eyebrows more prominent, to fill in the tear troughs of the eye. It's a very useful means of anti-aging treatment, because as we age, we do tend to lose volume, and a major impact would be achieved by using these volume fillers, and it really has moved us away from traditional plastic surgery, the facelifts. As you may know, the facelift is done much less now as compared to, say, 10 years ago, because of this innovation. Botox is another product that's injected, and that takes out the lines.
Let's stay, sorry to interrupt you, let's stay with that filler. Let me ask you a question or two here. When you do this, just let's come straight out. What are the side effects one need to look out for, or one can simply not avoid, and how bad are they? For instance, you start looking good, but you're going to get brain damage because all the chemicals are in it. I'm not saying you do. I'm trying to, and I know you're super conservative, looking out for your patients and always letting them know how, in fact, you usually get better results than what you let them know. So I have noticed. So tell us, what are some of the things a person need to look? And does once one has started, does one need to do it every week? Otherwise, one becomes like more ugly than before, or what's the deal?
Well, in terms of the time frame, the fillers basically can last anywhere from 4 to 6 months to 12 months. Some of them maybe a year or more than a year or two.
That's good.
We're looking at mostly. Yes, and we prefer as physicians the fillers that are not too long lasting, because if you have a kind of filler that lasts, say, 3 years or 5 years or 7 years, as we age, there are changes in other parts of the face, say. The area where you have the filler has not changed, but the other parts have changed. The face is going to be look dystrophic. It's going to be look different, and it's not going to be symmetrical. It's not going to look right. There's something wrong about that. For example, silicone has been used for as an implant, as a filler, and it's permanent. It stays there forever, basically. But other parts of the body or the face, they're going to change with time, and then this thing that's there is going to stand out, and it's going to look very funny. Now, in terms of the side effects and the problems, there isn't much of a problem to worry about. Obviously, a mild pinprick is what you feel, and the pain is totally bearable. Nobody has much of a problem with that. In fact, recently, some companies have added some lidocaine, some anesthetic material, to the fillers, so make it less painful to inject the material. Getting black and blue bruising is something that can happen. It's not that common. It can be prevented. For example, right after the procedure, we advise the patient to put some ice pack on. That helps it a great deal to prevent it. And also, if they do get some black and blue, we advise them to use some cover-up or warm compressor after a day or two to help this blood that may have come out of the vessels and under the skin to get absorbed to the body and disappear. Other than those, infection is very, very rare. Movement of the material is quite rare. The other side effects are so rare that it's not even worth mentioning. But anything can happen. There can be reactions, there could be allergic reactions, but they're, again, very rare.
Okay.
We have come a long way now.
Okay. And what about after 4 to 6 months when the material has, so to say, worn out? Can one do it again, or is it like a bypass surgery? You can only do 1, maybe 2, and after that, it's over. You cannot do it anymore.
In fact, it's recommended to do repeated treatments, because we know that the effects are going to wear off from time to time, and there's no problem doing the fillers again and again and again.
Wonderful. Wonderful. What about looking natural? You know what I'm saying? We all can put I'm smiling, I'm happy, and it doesn't look natural. And, the way you just smiled, that was natural. So how after a filler? Because when it comes to Botox, which is slightly different than this filler, I understand it is probably more advanced, maybe not, but maybe just a different thing altogether. Sometimes that's the fear and the complaint. If there's a fear about something amongst the people, that usually means that there's a reason for it. So how natural will it look? Very natural, and it depends on the doctor and to some extent to the patient. The way I do it is like this. I start putting in the filler, and I stop. I give the patients the mirror, and I ask them to look to see how it looks. Would they prefer a little bit here, a little bit more there, or this is enough? And we sort of work it together, and it comes out much better. We get better results. If I feel the patient is requesting something that it's not going to be good for them, then I would advise them and guide them not to do that. So I would have some inputs from the patient, and I get a feel. Some people want to have a very plump lip. That's fine. Some people don't want that. So we work it together and make it to look very natural. And that's really the key to any of these cosmetic treatments. We want to look natural. We don't want to
suddenly look like a frozen face, or too plump, or too sticking out.
Right. Well, wonderful. Absolutely wonderful. So there are many ways available, and I don't think at this moment it is. We can be talking about different procedures, of course, but I think at this moment, I think what's important is for people to know, and frankly, for people like me who start getting into that age, 58, and yes, kind of like being there and still, active and out there, and then kind of like, what about if things would change a little bit, and yet don't have this, cutting and surgery type of thing. So it's wonderful that there are many things which just simply make you a little bit look younger, and yet they're not surgery, they're not invasive, and they have no downtime. You can go to work the next day or the same day maybe, something like that. Absolutely wonderful. And then the doctor, once a patient comes to your office and you see the situation of the patient, you probably can rule out 2 or 3 things right away. You don't even need to mention it to the patient. Why does he need to know about something which doesn't apply for his face? And yet you can give him the 1, 2, or 3 things which perfectly apply, and can tell him how much of each one you could manage. And maybe there are sometimes a couple, 2 or 3 procedures together which might work, right?
Oftentimes, yes. Oftentimes people need different treatments because each one does a different purpose, has a different purpose. For example, the fillers do one thing, the laser does something different. The laser can tighten the skin, can get rid of brown spots, red spots, but it won't make your lip plump, or it won't fill up a very depressed scar. So the Botox is going to be used for the lines up here, which is very difficult to treat with other procedures. So we do recommend different approaches, different procedures, and combine all of them together. Oftentimes they can be done the same day. The sequence of it would be worked out.
Well, the key is to go to a doctor who basically has all the equipment, not just has one laser, because I know from talking to you and that there are, for instance, many. We laymen and we patients, we go laser is laser is laser, but for so many procedures, there's so many different lasers which basically operate and stimulate a different area. Some are going more deep, less deep. Some to get rid of brown spots. Some maybe generate collagen, whatever it may be. There's different lasers, and as long as you go to somebody who has a huge variety, like, go to a plumber who has all the equipment. He cannot just fix copper pipes or not just PVC pipes. He can fix all of them. That's basically the way to go. Dr. Ghatan, thanks a lot.